what kind of psychotherapy do you do with this? I remember in residency when they taught us this, the psychotherapist had us, and this is funny because to me, I don't really like touching toilet seats, to be honest with you. I don't think I have OCD, maybe a little, but I didn't really like the idea. But she basically was showing us how does she do this with patients. So a patient comes in, and they have a fear of contamination, just like our case. And she basically slowly exposes the person, just like any anxiety disorder, this is how you treat it. You slowly expose the person to what they're afraid of. Right? We talked about heights. You know, the more you're around heights, the less anxious you are about heights, right? So the more you're around a toilet seat, and the more you have to touch a toilet seat, the less anxious you are about it, and the less your brain lights up from your OCD, right? So she would have the person, first of all, you know, just in her office, away from any toilet seats, she would just have them talk about touching a toilet seat and not let them wash their hands or anything like that until their anxiety kind of settled down a bit. Then she might show them a picture of the toilet seat. Now pretend that you're touching this, right? Till there's no anxiety. You know, and each step, then she'd maybe take them to the doorway of the bathroom. Take a look at that toilet seat. What would it be like to touch it? Until there's no anxiety, you know, and then she wouldn't let them wash. It's called exposure, so you're exposing them to their fear, and response prevention. It means you can't let them wash their hands. So eventually, you know, then the next step may be that you put some rubber gloves on and you have them touch the toilet with the rubber gloves on. You can't wash your hands. Finally, touch the toilet. So this therapist made all of us poor, you know, psych residents come in there and touch this. She made us touch the rim, let alone the actual seat. So I don't know, that was too much for me, but my brain was probably going, you know, lighting up like crazy at that step. But anyway, by doing that over and over again, you know, basically the person's OCD calms down some, you know, and it's a good treatment for it. It's uncomfortable, certainly in the beginning and throughout the treatment, because you're exposing yourself to what you're afraid of. By the way, it's the same thing with any other fear. If you're afraid of spiders, there's two ways to do it. You can have spiders. You can have a fear factor and let spiders crawl all over you, and then you're going to get not so afraid of spiders after doing that a couple of times, right? Or you can slowly, gradually expose yourself to spiders over and over again, maybe by working in the zoo or, I don't know, somehow in your house if you have a lot of them. But the more you expose yourself to spiders, the easier it becomes. If you're afraid to fly in an airplane, the more times you do it, the easier it becomes. Because you're basically showing yourself that it's not that dangerous. I didn't die. You know, nothing terrible happened. I was able to make it. And, you know, that's how you treat all these anxiety disorders. Medication. The serotonin medications that we talked about, you know, the Prozacs, the Zolofts, the Paxils, they all work in kind of a similar way. They take a while to work. They take 10 to 12 weeks sometimes for full effect, and it's slow and gradual, just like it is with depression and other types of anxiety, but they do help. And really, if you think about it, if both the psychotherapy and the medications help, probably ought to do both. I mean, I would think that's the best way of, like I always say, any kind of illness or problem that you have, attack it from all sides. You know, if you attack a problem from as many sides as you can, you've got a better chance of beating it or succeeding in treating it. So that's OCD. Any questions about OCD before we go to the next disorder? I'm kind of flying here. Yes?
Does it always have to be linked to a fear? Or can it just be linked to anxiety?
Help me understand. The question is, does it always have to be linked to a fear?
Like
Or
organizational type thing. It's not really a fear that it's not organized, but it's an anxiety that it's not organized.
yeah, I guess depends on how you define anxiety. To me, anxiety is, maybe it's not as bad as, I think maybe people think of fear as being severe and anxiety not being as bad or something, but it's the same type of thing, right? Isn't it? I mean, maybe just degrees are different, but maybe we could say uncomfortable feeling or something like that, although that sort of makes it sound like it's not so bad, you know. You know, and again, these things aren't disorders unless they interfere with our function, right? All of us have some of these things, I'm sure. Like me, I didn't want to touch the toilet seat, but I don't wash my hands. You know, it's not like when I use a public restroom, I have to wash my hands 100 times. I mean, I wash them once, and I would go, and I'm gone. I don't think about it. So that's not OCD. Remember, all of us have these pathways in our brains, right? So we all have certain degrees of these things. It's just a matter of how much of it is, you know, how does that part of the brain work in each individual person? And there's 150 degrees difference between one person and the next, maybe. And some folks, unfortunately, have so much trouble that they can't. You know, for instance, with you're talking about anxiety with neatness, is that what you said, or symmetry, organization? You know, if it's so bad that you spend hours every day and you can't leave the den because you're organizing your National Geographic magazines over and over and over again, and it's taking you 6 hours a day to do it, well, you know, maybe that's a problem. I don't know. What do you guys think? Does anybody else think that'd be a problem? Maybe it's just me judging people, but that'd probably be a problem, right? You sleep how many hours a day? 6, 7, 8 hours? You know, so there's not a whole lot of time. So, you know, you got to work probably, or you do something, you know, take care of kids, whatever. 6 hours out of your day is kind of a chunk. It's a big chunk. I think that's, you know, who's to say, you know, in every person's life how much it is. Actually, to make the diagnosis, it has to interfere with your function. So it could be 2 hours, you know, and interfere with your function. Go ahead.
Do people just usually have one thing they obsess about?
Great question.
Disorder, or do they, like, you know, have to do several rituals?
Great question. That's a great question. The question was for the camera and for anybody that didn't hear it. With OCD, do people usually have one obsession and it stays? Like our case, is he going to stay? Is he going to just keep the contamination obsession and that's it? Actually, no. It's kind of interesting, and people switch. And I don't really know why that is. I can't figure that out. What'll happen is that it seems like the person will struggle a lot with a certain obsession. You finally get that under fairly good control, and then, you know, maybe they're stable for a while and it's not interfering with their function anymore, and the next time they come back they're worse, but it's a different obsession. It's changed to something else now. Maybe now it's a checking thing, you know, they have to check the stove or whatever. That's fascinating to me. I don't know why that is.
And they don't have more than one at a time?
No, they could have more than one at a time. Yep. So, oh, I see what you're asking. Yeah, they could have more than one type of obsession at a time, too. Yeah, they could have a couple different things. That's right. But it does tend to change. So they don't stay with how many they have. It doesn't stay that way forever. You know, they usually change to something else. It's an interesting thing to see. It's tough because a lot of times you'll see the person and you won't necessarily think of it being an obsession. You know, think of it if you're the psychiatrist. You know, the person comes in and says, well, one time there are people that have, like somebody who has a thought that, I might have hurt my children. You know, I might have gotten up in the middle of the night and killed my kids. And so now they're every 5 minutes getting up. They don't sleep because they're getting up checking to make sure they didn't do that. Of course, they didn't want to do that. It's not the issue. I mean, they didn't want to. That terrified them. But but the first time I treated them, it was a contamination fear. So it was not anything like that. So of course I'm scratching my head, going, "What the heck is that?" You know, and finally it clicks to me. Oh, this is another obsession. It's switched. So it's it's interesting as to how that happens, and it's don't know why that is. You know what I would imagine is that it probably has to do with things that are on the person's mind at the time. So things that are really, you know, if you just had kids, let's say, for instance, you know, and your kids are kind of young and stuff, and that's new for you. That's a new thing, and you're probably, like any mother or father, probably a little worried about, am I doing the right thing? Am I going to hurt the kid? You know, that kind of stuff. So maybe that's where this stuff comes from. You know, it's an underlying sort of anxiety or fear that you have anyway, and then boom, it gets turned into an obsession by the illness.